That was very, very exciting to see that integrated demo between the two platforms. So I want to congratulate both teams on going live. But before we begin, I'd like each of you gentlemen to introduce yourselves and the organizations that you're representing today. So we'll start with you, Rick. Please go ahead.
Hi, thanks a lot, Praveen, and congratulations on that video. It looked great. I'm Rick Strobridge. I'm the CEO of Rx.Health. I've got a long history in digital medicine and telesurgery and electronic health record integration, and really excited about our partnership.
Thank you. Satish?
Hi, I'm Satish Malnaik from NextServices, and at NextServices and my background, I've been involved with gastroenterologists for over 15 years, primarily addressing some of their specific needs around revenue cycle management, as well as EHR technologies, and in this particular case, endoscopy report writer.
Ashish?
Hi, I'm Ashish Atreja. I'm a gastroenterologist and Chief Innovation Officer in medicine at Mount Sinai Health System. By background, I'm an informaticist and currently leading the AGA Rx.Health Digital Transformation Network across US. So it's great to be here and great to see this collaboration coming through.
Rick, let me start with you. Please tell us a little bit more about what this partnership is about.
Rx.Health is a company that is a spin out of Mount Sinai, and this partnership aligns very well. Obviously, Dr. Atreja here is a gastroenterologist, and so we have a deep background in GI space in general. And Rx.Health is all about prescribing digital medicine. It's about being able to do medicine at scale very cost effectively in an automated way that allows these kinds of interactions to happen seamlessly with the patients. I'll give you an example. After COVID, we had at Mount Sinai about 1,500 past due endoscopies. They were elective, and obviously the elective procedures had been shut down by COVID. In one morning, we sent out 1,500 text messages to patients with past due endoscopy appointments. By noon, we had about 700 replies. And by the end of the day, we had 350 appointments scheduled. So that's an example of a one-button push automated way to get the patients engaged. Now, when we work with NextServices, we have a different care pathway that allows the patient information in what we call digital nudges to seamlessly go through their appointment. It gives us better bowel prep, fewer missed appointments, and just a better patient experience.
That's amazing. Now, Satish, the whole world has moved to the cloud and healthcare is slowly following. Enki is a cloud-based endoscopy report writer. Can you talk a little bit about the value of cloud-based endoscopy report writer and how this integration is going to help endoscopists?
Absolutely. I think, as everyone probably already knows, the progression of a lot of things to go cloud-based has happened in a lot of other spaces where healthcare has traditionally sort of lagged. Now, we've been working with gastroenterologists for over 15 years. And one of the things that we noticed happened often was that the information related to patients' data, especially around procedures, used to just stay within the four walls of the practice. And sometimes when this information is not quick or in real time, the usefulness goes down dramatically. So that's what we wanted to do with an endoscopy report writer that was cloud-based, is to be able to liberate that information so that it actually can support the patient care even outside the walls of when the patient's able to visit for a GI procedure. That kind of ability, if applied to traditional clinical care, has massive exponential benefits. And for us to be able to take the information we're already capturing in endoscopy report writers related to the patient, related to the care, and then be able to not just share that with the patient, but give them the ability to interact and provide feedback and information that would then subsequently go to their entire body of care, I feel was a required next step. And I think for us, being a cloud-based system and for Rx.Health to have the ability to be able to deploy such digital therapeutics through simple apps just absolutely made natural sense. And I think, without any doubt, the patient's going to benefit from a much better patient experience. And I think the providers and other clinicians are going to benefit from a higher patient satisfaction, in addition to a lot of value that's going to be created, which, again, Rich has pointed out earlier.
Wonderful. So, Ashish, while the whole world talked about prescribing apps, you actually went about building an entire company or initiating one around this concept, and that's quite amazing. My question to you is, getting to this point is one thing, but I'm curious to pick your brain and ask you, how does the future look from your lens from this point on, and when you look further out?
Absolutely. The Mount Sinai being the mothership, really where innovation started, where we found really the gap in patient-centered care, right? There are very good principles of the science of medicine, but where everyone struggles is delivery of care, delivery of that medicine. And because, as Satish mentioned, you hand over paper instructions to the patients, and 50% people were not having those paper instructions by the time they were doing procedures, right? By just bringing through digital therapeutics and apps the best digital care right to the patients, and by connecting them with electronic health records, it's now as seamless and as efficient as it can be, right? So we see the next 5 years as mainly the transformation part. Innovation has been done. We now have tools in nearly every service line, even beyond gastroenterology. We can provide end-to-end, not only digital front door, right from electronic health record, from AI, but from endoscopy and procedure specialties to surgical specialties to ACOs, and completely take risk. Because now we have tools for the first time to automate the patient journey from the very beginning till the very end in that regard. As part of this extension, you're going to see a whole virtual clinical trial network we are building on top of this. So while we are delivering care, we can capture real world evidence and enroll patients into clinical trial and generate evidence as well.
I want to ask on behalf of the GI community, what specific value can they get from this integration?
At different times in our lives, we are all patients, right? And I was a patient of an upper GI endoscopy just a couple of months ago. Unfortunately, they were not using the digital care pathways and the integration that we're talking about on this video. And so I received several phone calls. It went to my voicemail. I called back. I was put on hold. Those kinds of things. Instructions had to be dug out from several months earlier, as Satish had mentioned, in order to get ready for the procedure. And then things came in the mail. Afterwards, the survey came a couple of weeks later in the mail, the satisfaction survey. So that's just an example of the kinds of inefficiencies that were difficult for me as a patient. And we're also, that was spending time on the part of the office. And so the value of this technology is inherent. I mean, as soon as you experience it, we're all consumers, and we're used to the instant responses and whatnots on our mobile phone, and this is just taking endoscopy to that level.
So typically, one of the things we used to see is when there were problems within each practice facility setting, we used to address that problem on a one-on-one basis. But we're way past that world now, and I think now solutions have to be able to address at scale. I mean, that's just how the world works. And one of the big benefits we see here is what we're able to achieve and provide to, say, a particular provider, an endoscopist, by giving this ability of prescribing these tools and sharing this information with the patient. We're able to roll that out with just one simple partnership and modification to all the endoscopists and gastroenterologists that are now able to access the system.
What would be one piece of advice you have for the GI community, for the gastroenterologist out there who is watching this with regards to digital transformation?
Absolutely. I think the biggest challenge we see is people think, as a gastroenterologist, as a medical clinical community, we feel that digital health is way too expensive. and way too intrusive in our care. In fact, it's directly opposite. That right from day one, people can have an exponential value and ROI. So in fact, as part of AGA RX Health, one of our value prop has been, or what we want to do, is to actually bring the technology in such a seamless way, like with NK, that people turn it on. Within first 3 months, they generate so much value that it's a no-brainer to continue the procedure for rest of 5 years in that regard. So technology is now cloud-based and seamless turn on. All the clinical pathways, clinical intelligence is already baked in. So there's no effort needed to customize it. And you just turn on the switch and you realize the value. And till we taste it, we can never imagine how affordable, how accessible, how universal this is.
Amazing. Thank you so much, all of you. Was there anything else that you wanted to share?
I just want to congratulate both NK NextServices and RX Health for fulfilling AGA and our mission of being able to touch maximum number of lives in the most meaningful way possible. So thanks for creating a collaboration and supporting the network.
Thank you all. Thank you very much.